Health Info, bringing you well-researched medical information. Screening patients with diabetes for heart failure. Today we share some points related to the recent opinion by the American Diabetes Association regarding heart failure in patients with diabetes derived from the consensus report published in 2022. Diabetes is a precursor of many complications in a patient's body. Usually the more common or pressing concerns that physicians and patients have include complications related to kidneys, retina of the eyes, nerves, and heart. In recent years, however, there is growing awareness that patients with diabetes are also at a higher risk of developing heart failure. In recent years, however, there is growing awareness that patients with diabetes are also at a higher risk of developing heart failure. This is concerning since the global rise in diabetes rates puts more patients at risk for this debilitating and high-risk medical condition. Here we share some of the points discussed in the consensus report developed by the American Diabetes Association in 2022. Heart failure is a medical condition where the heart gradually begins to lose its elasticity and strength to pump blood as efficiently as it could. This causes the blood in the body to back up, and as a result pool in different parts of the body, such as the lungs and legs. Patients usually start presenting with small signs and symptoms such as inability to exercise as vigorously as they previously could or carry out daily chores. Patients may also start experiencing difficulty in breathing, coughing, increasing girth due to fluid in the abdomen area, and difficulty concentrating. It has been determined that heart failure is one of the first presentations of cardiovascular disease among diabetic patients. The risk of heart failure is 2 to 4-fold if the patient is also diabetic. This prevalence is currently at 22% and continues to rise. This relationship is bidirectional, meaning that heart failure and diabetes contribute to each other's progression. Risk of HF in diabetics is particularly high for Black, Hispanic, and Native American adults. Treatment considerations. It is recommended that patients with diabetes in the USA should have an annual biomarker testing done for pre-symptomatic heart failure, which is a situation where the heart failure is developing but not showing any symptoms yet. Treatment with SGLT2 should be considered for patients with pre-heart failure, also called stage B heart failure. Strategies to identify asymptomatic heart failure in patients with diabetes should be improved. These diagnostic tests include measurement of natriuretic peptids and high-sensitivity cardiac troponin tests on an annual basis. Interventions to improve the quality of life and slow down the progression of heart failure include nutrition, smoking avoidance and cessation, reduced alcohol intake, exercise, weight loss, relevant social determinants of health, alongside pharmacological interventions. Drugs to manage the condition include ACE inhibitors, or ARBs, thiazide-type diuretics, mineralocorticoid receptor antagonists, and new drugs such as finerenone. The role of SGLT2 inhibitors is now increasingly recognized and being recommended for patients with diabetes and symptomatic heart failure. The group concluded that there is need for early screening and detection of heart failure, and interventions should consider a multidisciplinary approach. Since diabetes can worsen the progression of patients with heart failure, patients diagnosed with heart failure should continuously monitor their condition and symptoms and arrange regular checkups to maintain the optimal level of health. Keep watching our videos to learn more about diabetes and heart failure. If you like our videos and want to learn more, please leave a comment below. Subscribe and share to help others.